continuing from where we stopped yesterday. First question on the board: which of the following uh, is measured on an ordinal scale? Yeah, more like except. Can inform your friends in the group that discussion has started. Okay. For those who don't understand, cancer has stages. So basically, ordinal scale is anything that has an order. So cancer has stages, which means it has an order. Has a stage, it has grades. Consciousness level, you can use Glasgow coma scale, which has stages and levels. Blood group is nominal. That's just the name. Okay. So it does not have an order. So AB, AB, and O. About the cardiac, I don't know, maybe it's myocyte they're talking about. Presence of sparse fibrils, absence of myofibrils, automaticity. Okay, so of course, automaticity is one of the major symptoms of features of the heart. Question is not clear, but that's what we expect from the course. Yeah, polyposis talks about polyps, you know, malignant polyps that are present in the GI. So Lynch syndrome, Gardner syndrome, all those things are associated with it. Chronic inflammation could be maybe Crohn's disease or ulcerative colitis, although there's increased risk of malignancy with especially ulcerative colitis. Um, it's not essentially polyps. About other receptors located in the olfactory bulb on neurons. Who is this person now? Who is this person now? People are not kids now. Stop distorting the discussion. Located in the olfactory bulb on neurons from from where it is transmitted to the mitral cells, then olfactory cortex. Somebody has even deleted something. Yes. Other receptors are located in the olfactory bulb, located on the neurons from where it is transmitted to the mitral cells and then to the olfactory cortex. Are G protein coupled receptors located on the olfactory sensory neurons, the olfactory epithelium, are ligand gated ion channels located on the olfactory nerve. Well, They are indeed G protein coupled receptors located on the olfactory sensory neurons of the olfactory epithelium. The option B is also correct. Option B is also correct, but like if you are looking for the best option in this situation, the one that describes the particular thing they're talking about specifically, okay, is the option C. But if option C is not there, then you choose option B. They are not ligand gated, they are G protein coupled. So, dotted lines. The following causes plant sediment in CKD, except DM, hypertension, SLE, FSGS, um, MG. So option C, SLE is the most likely answer. Because it's bland sediment where like the urine may not have some of those sediments. Like it has very few cells or casts. Most appropriate diagnostic test for CD4 counts, ELISA, electrophoresis, immunoassay, complement fixation. So ELISA, enzyme linked immunosorbent assay, is the best technique for quantifying things like that. Following are typically found Following are typically found in Sjogren's syndrome, except xerostomia, keratoconjunctivitis sicca, dry eyes, skin and vagina, Schema tests, hypersecretion of lacrimal glands. Who is this person? Remove your mouse from the screen. So you cannot have dry eyes, which is a characteristic of Sjogren's syndrome, and at the same time be having hypersecretion of the lacrimal glands, because the in Sjogren's syndrome, the lacrimal glands are not even going to be secreting. It's going, even if they are crying, they will not have tears. They will cry without tears. So, question on fungi.
No, 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 no. I'm done. Okay. All right. Have a nice night. Okay, thank you, sir.
So, which of the following statements about fungi is most correct? Cryptococcus exists as a mold in the soil but as yeast cells in the host. Coccidioides is transmitted by pigeon droppings. Aspergillus is only pathogenic. Dr. Musty, remove your mouse, please. Aspergillus is only pathogenic when it invades tissue. Dermatophytes, I'll have to remove you to solve it if you don't want to move your mouse. Dermatophytes cause systemic infections. So Cryptococcus exists as a mold in the soil. Uh, so when it gets into the human body, to change back to yeast cells in the host. So that's correct. Coccidiosis is transmitted by pigeon droppings. Okay, which is also correct. Sorry, Cryptococcus is the one that is transmitted by pigeon droppings, not coccidioides. Okay. Aspergillus can cause allergic reactions. So it doesn't even have to um, invade the tissue. It can even cause other non-invasive diseases. Then dermatophytes do not cause systemic infections because they are by the term dermatophytes means it's just on the skin, on the superficial hair, nail, skin, not systemic infection. So um, the only correct option is option A. Leptospirosis, except caused by gram-positive rods, gram-negative spirochete bacteria, obligates aerobic, associated with rats, rainfall, rice field, transmission by either direct or indirect contact. Leptospirosis is very well known for causing something called the whale's disease. So it's a gram-negative spirochete. Spirochete means it's like a spiral shaped, so something like that. It's not gram-positive; it's gram-negative. Leptospirosis, except caused by, okay, uh, this is the one we just finished. So an increase in ejection fraction will cause which of the following to increase?
Yeah. I'm sorry, please. What was the answer to the last one, the leptospirosis?
And option A, which of the following is decreased when there is increased ejection fraction, um, end systolic volume, stroke volume, EDV, HR. So of course, if ejection fraction, which is the summation of end systolic volume and sorry, cardiac output is the summation of, so ejection fraction is percentage of blood that is ejected from the left ventricle with each contraction, right? So it means that if you eject a particular amount from the heart, the remaining one will be the end systolic volume. That's at the end of the systole, which is option A. If anything, if you increase the ejection fraction or cardiac output, the end diastolic volume will actually increase. It's the end systolic volume that decreased. following is decreased in exercise. Total peripheral resistance, heart rate, cardiac output, stroke volume, pulse pressure. So if anything, total peripheral resistance will decrease because there will be vasodilation during the exercise activity. You expect there to be vasodilation to enable an increased blood flow to the muscles and peripheral tissues that are being utilized for the exercise. Statistics question that answers yes or no between two variables. What scale of measurement is that? Is it ordinal, nominal, interval, or ratio? So there is nominal scale, ordinal scale, interval scale, and ratio scale. So nominal scale is just basically name, as the name implies, nominal name. Okay. So male or female, just mutually exclusive unranked categories. Male or female, yes or no, single, married, divorced, marital status, something like that. They are all nominal scale. Ordinal is when you now have ranks, like we answered earlier in a question about blood group is not to be blood group will be nominal, while what's that one that was there again? Consciousness level through the Glasgow Coma scale will be ordinal. So it has a scale, it has a range of values. Interval scale is ordered category between with equal intervals between values. So there's no 0 point. Example, temperature in Celsius or Fahrenheit. Okay, so there's ordered categories, equal intervals between the values. Then ratio scale, um, there's order, okay, with equal interval, and then you will say there's a true 0 point. There's height, weight, income, etc. So yes or no is a nominal scale. Which is a prominent feature of primary acne vulgaris? Papules, open comedones, pustule, nodules. So in the descriptions of acne, the typical rash of an acne is called a comedone. So there's open comedone and there's closed comedone. Most acne are going to be closed comedone. The ones that are much more complicated are the open comedones. So apart from the comedone, eventually, if not well managed, it can change from a comedone. Uh, you know that thing that looks like you can squeeze it with a black dot on top. That's a blackhead. Then when you finally open that blackhead and something comes out, that's a an open comedone. An open comedone. That's a white head. Then if it progresses beyond that, you can still have pustules, nodules, and other stuff. But the primary lesion of an acne vulgaris is those comedones. Which of the following statements about liver anatomy is not correct? The liver receives approximately 1.5 mils of blood per minute. The liver has dual blood supply from the hepatic artery and the portal vein. The liver is surrounded by a thick fibrous capsule. The liver is located intraperitoneally. There's a part of the liver called the bell area. That's the only place that is not covered by the peritoneum. Apart from that, every other part is covered by the peritoneum. But the only thing is that it's not covered by a thick fibrous capsule. So Gleason's capsule um, is a thin, it's guided as a thin capsule, right? Overlapping the liver. Depends on how you see the question anyway. That will determine what. So just analyze it well. So the liver receives 1,500 ml of blood per minute, and the portal vein will supply about 75% of that blood flow, but only about 50% of the oxygen. The hepatic artery will supply about 25% of the liver's blood flow. So most of the blood flow is coming from the portal vein. So, but they share oxygen supply 50-50. And of course, blood from the portal vein is oxygen poor but nutrient rich. So it's rich in nutrients and all that. Blood from the hepatic artery is oxygen rich but nutrient poor. Which of the following is responsible for the respiratory burst in inflammation? GCSF, interleukin 1, NADPH oxidase, TNF alpha. So when you talk about respiratory bursts, you're referring to that period when there is a rapid release of oxygen species. Okay, so immune cells like neutrophils and macrophages, how they kill organisms is to rapidly release um, those toxic reactive oxygen species that will destroy the cells. Okay, so NADPH oxidase is the primary enzyme involved for this. Granulocyte colony stimulating factor. That's basically what stimulates the bone marrow to release more of granulocytes. So that's not what is responsible for the what they call respiratory bursts. Diabetes insipidus. Insipidus. Which of the following is not typically a feature of diabetes insipidus? Eyes water preference, polyuria and polydipsia, hypernatremia, and high urine osmolarity. Yeah, they are going to have low urine osmolarity because basically they are losing water because they don't have antidiuretic hormone. So water is not getting reabsorbed from the collecting ducts as it's supposed to be. So their urine will be so diluted with low osmolality. So that's hypoosmolality. They have polyuria, polydipsia, and they would like to drink cold water because they have hypernatremia in their blood. So they're always thirsty. Some questions have very poor stem. So it comes okay, let's see. CKD except interstitial scarring, glomerular disease, PKD, acute PSSG. So yeah, so option D, the one that says acute. even if it will lead to be in the long run, but like these ones are like primarily um, chronic. So the next question is about amyloidosis or amyloid. So the following statements about amyloid is correct. Uh, Amyloid deposits are composed of aggregated immunoglobulins only. Amyloid deposits are only found in the heart. They are composed of misfolded proteins that form beta-plated sheets. They are easily degraded by macrophages. Option D is the answer. So amyloid deposits are not only composed by immunoglobulins, they can be composed of various proteins. So not just immunoglobulins. Uh, they are not only found in the heart, they can be found on many organs and tissues throughout the body. Can be deposited everywhere. Uh, yes, so they are composed of misfolded proteins that form those sheets. Okay, they are not easily degraded by macrophages. They are in fact resistant to degradation. So they tend to accumulate in tissues because they are resistant to degradation. That's why amyloidosis is when you have amyloid bodies accumulating everywhere, all over the body, being that it's difficult to degrade. So this one is an biology question. Chronic chorionic villi. Chorionic chorionic villi, most prominent during gestation at what age? 4 to 8 weeks, 14 to 20, 14 to 28, 30 to 36. the thing to note is that by 14 weeks, the chorionic villi are no longer prominent. So anything you are doing, you have to do it before 13 weeks. So we have to choose the one that is lower than 14 weeks there, which is option A. So they are most prominent during that 4 to 8 weeks, but by 14 weeks they would have become almost undetectable. Then the next question is about chorionic virus sampling. Chorionic villi sampling 6 to 12, 12 to 13, 14 to 20. So when would you like to sample the chorionic villi? So it's usually from um, pick the second one.